Another one is hemiplegic migraine. When the person has migraine, I know that migraine is a common thing. When you have migraine and the migraine is causing a form of paralysis in one side of the body, it's not stroke, but it needs to be identified differentially. That is why we say there is need for differential diagnosis, whereby you look at other things that may mimic or give you symptoms that resemble symptoms of stroke. So you need to ask further questions. You need to carry out some investigations to be sure that it is stroke the person has really, and not some other things that mimic or look like stroke. Another one is encephalitis. If there is inflammation of the layers of the brain, linings of the brain, there may be symptoms that look like stroke. If there is brain abscess, if there is an infection that affects the brain and there is an abscess, there may be symptoms that look like symptoms of stroke. If there is a form of cerebral neoplasm, neoplasm is like abnormal cell development in the brain. It may give you symptoms that will look like symptoms of stroke. If there is syncope is also a sudden and short, loss of consciousness, fainting attack. Okay, when this happens, it may mimic stroke or make you think the person has stroke, whereas the person does not have stroke. If there is convulsion, in convulsion disorder, the person may have symptoms that may look like stroke, especially after the convulsion episode, and the person is at rest. The person goes into unconsciousness that may feel or look like stroke, and it's not stroke.